Hi, thanks for joining me again today. Dr. Hedrich here. Today we're very fortunate that we get to speak to Irene. She's been a patient at the clinic now for about 3 months, I think, maybe a little bit longer. And we're going to hear her story today. So let's turn to Irene. Irene, thank you for taking some time to talk to us. I really appreciate this. People like to hear stories about what's happening with other patients, their experience, and that way they can relate to things, see if they have a similar problem, and then make a decision on care based on that. So thank you for taking the time to talk to me.
Glad to.
Can you tell me a little bit about well, let's back up first. How did you first hear about me?
From a friend at Milk River, Wendy.
Wendy? Okay. And what did she say that made you decide to come to see me?
It's not so much what she said, it's what I saw, the improvement in her. Because I knew she had the problem with the MS, and I just felt that she seemed like she was doing so good that I said, if you could help her, then I'm sure you can help me.
Okay. Yeah. Well, that's good to see. Walking advertisement for me.
Yeah, well, I guess so.
Super. So, what was life like for you before you came into the office?
Well, I had a lot of pain in the lower back, and of course I did go to chiropractor, but I just didn't seem like I was making any progress. And when I talked to Wendy, I thought, well, okay, let's have another opinion and go from there.
Okay.
And so that's what brought me to you.
And how was that lower back pain affecting your life?
It was bothering me down the legs. You know, my legs were always sore and felt weak. And the pain was just there all the time, and it just didn't seem like I felt any better after a treatment than I did before I went there.
Okay.
So.
Then you decided to come into care. We did an assessment, and we found a pretty substantial misalignment in your spine, didn't we?
We sure did. Yeah.
And we started treating you, and it wasn't night and day difference. I don't think it took us a little bit of time to get you starting to feel better, right?
Yes, it was. It was at least well over a month before I really noticed a difference. Mm-hmm. Yep.
I find that when you have a serious problem like that, they don't cure or get super good overnight or anything like that. It's a process that people have to go through.
Yes, because I think it was there for a long time, so it's going to take a long time to straighten it out.
Yeah. That's true. So now, how is life better? What can you do now that you were having troubles with before?
Oh, I can do most anything. I do tire. There's no getting away from that. And if I overwork myself, then definitely I'm going to be sore. But doing things, I do notice a difference that the aches and pains are not quite the same. And then, you know, if you lay down and rest for a while, they seem to go away.
Okay.
But there's definitely been a great improvement as far as I'm concerned.
Great. Well,
yeah.
Thank you. And I really appreciate you talking with us again, and I hope that helps people make some good decisions on their own.
I hope somebody else will decide that this is the place to come.
Thank you.
Okay, thank you.